Hi, everybody. Can everyone see the slide? Is that visible?
Yes. Yeah.
Perfect, thank you. Hi, everybody. Welcome to Creating Careers Live with Health Education England. This is now our podiatry session. Our therapist is not here, but we are going to speak to Molly in a bit. If you've never been to a Creating Careers Live before, though I hope you have, we're going to do a quick run through of what it looks like. So housekeeping wise, if you can just keep your cameras and microphones off, it just helps with the bandwidth. It means that we're not getting lagged with the internet. This session is recorded. So again, if you don't want that involved, keep the cameras and mics off. These will be uploaded at a later date on the Creating Careers Live section of the Liverpool City Region's CEC website. And we will share that in the Google Classroom, which I'll speak to you about in a second. At any point, if you have any questions or anything, pop them straight in the chat box. There will be an opportunity at the end for a Q&A. But of course, if you have questions after the fact, that's where we use the Google Classroom. So today we're going to have the intro, which is from me, a bit of housekeeping, and then we will be moving over to Leslie Ann, who's going to give us our interactive session, which is a lovely quiz. Then we're going to have an interview with Molly about her experience with mentoring and being a student, training to go into the NHS. And then we'll move on to our podiatry. And then finally, you'll be back here at 5:20 where we'll wrap up and we'll just ask any questions that you need answering. On top of that, this is a Northwest-wide event. You might be from all over the Northwest. We have tons of partnerships in the Northwest. So I'm Liverpool Shaping Futures. We also have Future You, Greater Manchester Hire, Hello Future. They're all here to support you throughout everything. If you need any extra support, if you're at the stage in your journey where you're picking your options, you're looking to go to university, you can get in touch. We can provide one-to-one guidance there. But on top of that, they will be able to answer questions in the Google Classroom too. I know this was in the email you all received, but I would really recommend, if you haven't already, joining there. It has all the resources from our previous sessions, but on top of that, it has options for you to put your questions in the chat. We get back to them at any time. You can speak directly to people who are working on this program, and you can see all the important links and resources there. So after this, you will be able to see it on the YouTube channel. We'll have a follow-up email that I'll go through in a minute. The Google Classroom is really the prime here. So I will hand back over to Leslie Ann, and we will get started.
Hi everyone. So what I'm going to do is I'm just going to share my screen, and then we will start with our interactive session based on our pre-work learning. So can someone just indicate to me that they can see my full screen?
We can, Leslie Ann, yeah. It's all
fantastically on. Sometimes I have some disasters with that, so that's a relief. So if anyone new is watching, obviously we some students coming back week after week, and we love that. If anyone is new to Creating Careers today, we send out pre-work with every session. That is to prepare you as much as possible for what you are about to learn about during all of our webinars. Now, what we like to do is have a quick pre-work session to warm you up at the beginning of every webinar. And that is also to check your understanding. It gives you a little bit of feedback on that pre-work, make sure you've understood all the key elements. It helps you to prompt any key questions that you could ask for our volunteers who are going to be on later on in the webinar. Now, I can please ask you get as involved as possible. Your cameras are off, your mics are off, so you've got nothing to lose by getting as involved as possible, putting your answers in the chat, using the polls to share your opinions. No one is checking individual scores or individual answers. It is just for your knowledge to get involved and get some feedback on your pre-work. So to start off, to warm you guys up, I've got 3 statements on the screen. I want you to tell me, think about today's session. What do they have in common? What is the common denominator here that I am trying to get at? So we've got our first statement, children with problems walking. B, circulation problems due to diabetes. Or C, sports injuries. So get into the chat and tell me, what do those 3 statements have in common, do you think? Think about them carefully, and what do you think those 3 statements have in common in relation to today's webinar. Come on, let's warm up a little bit. The chat's being a little bit quiet at the moment. So we've got one saying movement. Okay, fantastic. It's along the right lines. Thank you, Ruth. Anyone else got anything that they think those 3 areas might have in common? Think about why you are on here today. Come on, someone, anyone, help me out. Leon, feet along the right lines. We're getting hotter and hotter and hotter. So feet, how can we build on that? Come on, what do they have in common, those 3 areas? So movement and feet. Think about today's session. What are we all here for? To learn about? They are issues. Circulation, they are issues that are dealt. Yogan, thank you so much. They need 5. Ray, brilliant. Zoe, brilliant. Podiatry, wonderful. Nice and warmed up now. They are all issues that a podiatrist would deal with, okay? So let's build on that of what a podiatrist actually is. So I was thinking to myself, if I could write a definition in 1 sentence of what a podiatrist is, I've put something on the screen there, but there is a key element missing from that. I have missed a key element from the description, the definition of what a podiatrist is. And I want you to think about your pre-work to tell me what I have missed, okay? So as a podiatrist, you'll help people deal with a range of mobility issues, relieve pain, and treat infections of the feet. Now that's all right, but there's something really key about what being a podiatrist is that I have missed there. Can anyone? Oh, Yogan, absolutely marvellous, love it. Treatment of the feet and the legs, it's the lower legs as well. It's not just about feet. Podiatrists will also focus on lower legs as well. So please, please don't forget that. Often people associate it just with feet. Wonderful. So on to our next element. So we know what podiatrists do. We know the kinds of issues they deal with. We know where they work with, so the feet and the lower legs. Now, using that knowledge, and if you've been on any other Creating Careers sessions over the course of this series, knowledge of other healthcare professionals, put them together and answer this question. Podiatrists work with a range of other healthcare professionals, such as, so using your pre-work knowledge and your knowledge of other healthcare professionals, who do you think in health, in the NHS, other job roles, what other job roles do you think a podiatrist would work with? Okay, any job role at all. Think about who work in hospitals, think who work in practices. Okay, Ruth, fantastic. Leon, fantastic. A physiotherapist. We've got yoga again with the GP, fantastic. Andy, dietitian, I love it. Absolutely brilliant. Now, can I just home in on something a little bit? Because when you're in school and you give an answer to your teacher and you still ask you a question, your teacher will always say to you, it's not enough to just give the answer, you have to explain why. So, Yogan, you've given the example of physiotherapy there. Can you tell me why a podiatrist would have to work with a physiotherapist, do you think? Or anyone out there? Come on, let's make sure we explain our answers. We not only give them, but we explain them. It's the same for careers. You're going for any job interview, you need to explain yourself. Okay, whoops, I've gone, the slideshow's gone ahead of itself there. Okay, right. Okay, so you're saying maybe the work with the physiotherapy because they're both working with feet. Okay, fantastic. So physiotherapists will work with mobility, just like a podiatrist would. We were very right, Andy, in saying about dietitians. In your pre-work, we had the example of a podiatrist who specialises in working with patients with diabetes. Diabetes, obviously, patients with diabetes have to think very carefully about their diet. So they'll work closely with dietitians. We've got GPs, as you very rightly said. GPs, when we did our session on primary care, that'll be your first point of contact when something's wrong, and they will refer you to the relevant person. They also work with nurses. Okay, so you can see how all these different Creating Career sessions that we run, all these different job roles tie in. So even if you don't necessarily want to do the job role that's on focus during each week's webinar, it's really useful for you to tune in, because the job role that you're interested in will be working with those different roles, and it's really useful and helpful for you to understand what they do. Okay, so you can see how all these roles that we show every week tie in together. And also, podiatrists can also work with sports professionals. They do a lot of work with marathon runners, people who are putting a lot of impact on the lower legs and feet. So there are a wide variety of people that they work with. So hopefully that's warmed you up nicely for what podiatry is, ready for our interview with our expert. Now, the other area that we were going to look at today was art therapy. Now, unfortunately, the art therapist who was going to come on today has had a little bit of an emergency, so can't join us. But what we'll do instead, I'll go through a little bit of what art therapy is with you now. And any follow-up questions that you have about art therapy, you put them through in the chat and we will get them answered for you. We will do a follow-up session with the art therapist. We can record it and put it out there so you can watch it at a later date. So just to get your ideas flowing of what art therapy is, art therapists use art as a medium to address emotional issues, which may be confusing and distressing to patients. So they use art to help people express themselves when maybe they find it difficult to express themselves with words. So they work with people with all different ages, children, young people, adults, the elderly. So clients have a range of different difficulties. It might be emotional, mental health, learning disabilities, neurological conditions, physical issues. So with that in mind, our therapists work in a variety of different settings. By settings, I mean where they work. Now I want you to think, where, such as, give me an example, what different types of settings do you think an art therapist would work in? Think about the different types of people they work with. Think about your pre-work learning. And put an example for me in the chat of where do you think an art therapist could work based on who they're working with. Okay, have a little ponder, put your ideas in the chat. Think about the different people they work with. They work with children, they work with young people, they work with the elderly. Okay, what type of setting do you think those people would work in then? Where would an art therapist work with a child? Okay, fantastic. We've got schools, hospitals, GP practices, care homes. That is absolutely wonderful. Thank you for contributing there. Yeah, so there's all different types of settings because they're working with so many different types of people. It wouldn't necessarily just be based in an NHS hospital setting or a GP practice or whatever. They could work in social services, education, so schools. They work in prisons, private practice. They might set up their own private practice and people can come to them. As we've got there in the chat, youth clubs, leisure centres, absolutely brilliant. So moving on with art therapy. So we know a little bit about what art therapists do and the types of people they work with. Now, they can work with clients on a one-to-one basis, or they can also work in groups with clients. Now, what do you think the benefit of group work would be? Think about what an art therapist does. They help people express themselves or overcome difficulties through art. Okay, why do you think it would be beneficial for them to work in groups? What would be the benefit of all creating art together? Okay, fantastic, thank you. So if you look in the chat, we've got a suggestion about supporting one another and shared experiences. Yoga, fantastic, mutual support, not being the centre of attention. So wonderful, more ideas if you work together. Ruth, people will help each other, fantastic. So art therapy is all about communication. It's all about using art to communicate. Now you can all sit in a group setting and use art to relate to each other and communicate with other people. The groups can look through each other's art and discuss what they think the meanings are. Someone might see something that you don't, and it really just encourages people to communicate, okay? So if you've got any questions at all about art therapy, please put them through into the chat and we will get them answered for you. Any pathways in, any specific questions about the day-to-day job, put them in the chat and we will get them a follow-up session for you to make sure you get all your questions asked for art therapy. So usually at this point, we might look a bit deeper into both roles that are on offer, and we might look at the skills that are required and how they link to the NHS values. Now I'm going to do something a little bit different for the last 5 minutes of this part of the quiz. But just before I do, just to highlight that the NHS values are essential to any course or any job role that any candidate would want within the NHS. So it's essential that you know them really well. We've done other sessions where we've spent the whole pre-work quiz going through it. But with every pre-work booklet that we send out, slide 3 gives you everything you need to know about the NHS values. You could hover over each icon, you can see videos there of how to access more information about them. There is a challenge for you to complete, and that gives you everything you need to know about the NHS values and how important they are for any application. So please make sure you check that out if you haven't already. So what we're going to focus on now, just for the last 5 minutes of this session, is mentorship. Now, at Creating Careers, we offer one-to-one mentoring support. So by coming onto this session, you as a student have got the offer to have a mentoring relationship with us over 12 months to help you within a career of health and social care. Now, we've got lots of interest in this, but we feel that still some students are a little bit unsure of taking up this brilliant offer. So I want to find out what do you feel is stopping you? What are your barriers to taking up mentorship? What makes you feel nervous about it? And then we may go through a little section to address those issues. So a poll's going to come up in a minute, and I just want you to think, what is stopping you taking up our mentorship offering? Is it time? Do you think you haven't got time to commit to it? Is it confidence? Do you feel you're a little bit shy, or you're not confident enough to do something like that? Do you feel like you just don't need the support? Or lastly, is there another reason? And if so, explain it in the chat. No one is checking your answer for this, so please just share it because it's really useful for our feedback. What would you say is the main reason why you feel you may be a little bit hesitant about taking up the mentoring offer? So if you put your answer in our poll, and we'll see. Fantastic. Now that is quite a staggering result, really, with confidence coming through massively. So we've got other explanations in the chat saying they're not sure what they want to be in the future, so maybe that puts them off mentoring. So we've got those two elements, really, confidence and not being sure what you want your future to be. So let's have a little game of true or false, and we'll use that to address those issues with mentorship. Okay? So true or false, you're going to get a poll come up. I want you to tell me whether you think this is true or is it false. Mentoring is only for young people who know what they want to do in life. Is that true or is that false? Submit your answer and let's see what the results are. Oops, I'm skipping ahead of me. Fantastic, false, 100%. I'm glad we're all agreed on that. Mentoring is for everyone. So those people earlier who said they're not sure what they want to do, that's why they're not taking it up. It's for everyone. It's for people who know what they want to do, and it's for people who need support and guidance with what they want to do. So if you're lacking confidence, thinking, I don't really want to take up that offer because I'm not sure what direction I want to go in, I'm a little bit shy with this person, that's what that person's there to help you with, to guide you, to give you ideas of things to look at. And if you're thinking, well, I know what I want to do, so why would I bother? Well, these roles can be competitive. To show you've gone through a mentorship program, put your application above others. Mentors can share key tips with you, maybe events like such as these that will help you. You can also maybe look at applications. So it really is for everyone. Okay, so our next true or false, mentoring is just about getting a job. Is that true or is that false? Wait for the answers to come through. False, fantastic, 100% there are false. It is. Mentoring isn't, although it can support with getting a job in your future career, it isn't just about that. It's about building confidence. That's why everyone there who feels that they're not confident should be going on this mentorship program. It will build your confidence. Talking to someone, building a relationship, building skills together, building networks of people. They may introduce you to new people, new ideas. okay? And that doesn't always have to be about a job. You might have exam pressures going on that you feel you need support with. You might have issues with, school life, personal life balance. Mentoring can help you with all of those issues, okay? Next one, true or false? A mentor from any industry can offer valuable advice and support. I think that's true or false. Let's wait for our result. Okay, fantastic, 100% at true. You don't just need to be mentored by the person, say for example, you wanted to be a physiotherapist. You don't just need to be mentored by a physiotherapist, okay? Anyone in any role can offer you invaluable advice and support. If you come on all these sessions, you will find there's a key pattern: transferable skills, communication, working under pressure, teamwork, interpersonal skills. These all transfer from job to job, whether it's in healthcare or any kind of other sector. You can get a mentor to help you with that. And you in any job will be working with a variety of people from different backgrounds, from different sectors. So having been mentored by someone from a different background, different sector is so useful, different points of view, okay? So what we're going to do very lastly, mentoring has to be face-to-face to be effective. Is this true or false? You need to meet face-to-face for it to work, basically. False. Wonderful. Mentoring can be online. It can be an email exchange. It can take any form that you want it. And those people who think they haven't got time to commit to it, you can manage the time that you spend with your mentor. It's all about you, okay? So it doesn't have to be, right, you have to come here 3 hours a day to talk to your mentor. Not at all. You guide it, okay? So mentoring can be in any form, any communication form that is effective for you and helps you with your level of confidence. You may not feel that you want to sit and talk to someone on a video camera or whatever. It could just be a case of email, asking your mentor, are there any events that are useful, or can you look at my application? Okay. So the last question, I'm not going to answer this one because it leads on to what I've just spoken about, but you as a mentee lead this relationship. The time it takes, your confidence level, whether you know what job you want to do, you lead this relationship. You are in control, okay? How this offer works, when it works, what type of issues you talk about, what you want to develop, you are in control. So I hope that helps with a little bit of confidence issues. Now, I'm just going to skip through. I know there were some poll questions, but I'll just leave that for now just to save on time. Now, when we launched this session, when we launched the stage of Creating Careers, we opened with a session all about the benefits of mentoring. I will put a link to that in the chat so you can watch that if you want to learn a little bit more about mentoring. But you have the offer to take up mentoring with us. You also have the offer of other mentoring offers within your region. So we've got the example of 1 Million Mentors. They come on and spoke to students. Now they're for students 18 to 25, so a little bit older than what you're up to, but something to think about for the future. And you've also got Mind. Minds are in all different regions and can help you with mental health support. So if you are interested in any of our mentoring offers, get in touch with our email address there, careershub@growthplatform.org. You can ask on the Google Classroom that Abby spoke about earlier. The joining code is there. I'll also put these in the chat. And you've also got all these wonderful UniConnect partnerships that Abby spoke through at the bottom. You can see all their logos at the bottom of the screen. So wherever you are in the Northwest, whether it's Liverpool City region, Cheshire, Merseyside, Greater Manchester, Lancashire, South Cumbria, Cheshire, Warrington, wherever you are, there is someone for you to support you. So get in touch with us and use us to support you with your mentoring. Now, what I'm going to do now is I'm going to introduce, on the theme of mentoring, I'm going to introduce an individual to come on to screen with us, Molly. So Molly, could you just pop on screen for us, please? Hello, Molly. How are you?
Thank you.
Now, I'm just going to introduce Molly because I have to say Molly is an absolute superstar and has worked with us in the past because Molly attended one of these sessions like you are attending today in the past. and use that to actually launch a career in nursing. So I'm going to ask Molly to just talk about her experience with going on these kinds of events and what mentoring did for Molly. So it links in really well to what we spoke about in the pre-work quiz. So Molly, currently studying nursing at Liverpool John Moores University. What are you finishing your first year?
Yeah, first year.
Brilliant, brilliant. And I've heard all about, there's a promo video with Molly coming out talking all about her story. That will be out. We'll put that in the Google Classroom so you can get more details about Molly's story. So Molly, just to introduce the students, talk through. So you went on an event, was it December 2020? Similar to what we're doing, all about nursing. So how did you find that useful? What did that do for you in your career, did you feel?
I was in college at the time, much like, you know, the people on the other side of the screen looking, probably finishing school, college or whatever. And I had no idea what I wanted to do. Absolutely clueless. I did a range of kind of courses in college. None of them kind of linked together, led to a certain role. Clueless. So I hopped on to one of these kind of sessions, no idea what to expect. And it was, honestly, it was brilliant. I was able to speak to nurses. I think there was paramedics, like a full range of kind of like different professionals. And obviously I managed to get a bit more insight on nurses, asking those questions, you know, from the security of no one knowing who you are. You can ask, you know, those stupid questions that you think, you know, you can't really ask, you know, someone to their face, but really it's those kind of questions that get you the most insight and the valuable answers. And you know, these kind of opportunities like this gave me the chance to ask them. And I don't know any kind of nurses or anything like that, so it's an experience that I couldn't get anywhere else, and it was definitely useful to me to kind of signpost me on where I wanted to go, to hop onto this mentoring. So I guess kind of touching on what you were talking about before about the mentoring, I just recommend to anyone kind of watching this, like now or later when it's uploaded elsewhere, to hop on, have a look, check it out, because it helped me. Worst case scenario, you're going to find things you don't want to do, and you've got a better idea of what something else you might want to do. You're not going to look back regretting things that you didn't try or whatever. And you know, you're going to get insight on things that you didn't think you'd find, especially when you can't get, you know, work experience in everything. You can at least kind of talk to some of these professionals. I know we've got one on later on about podiatry. I've got no clue what that's about. I'm interested to ask questions on that, but definitely hop on and just join that mentoring and get the help. I'm not confident myself really, or I didn't have an idea of what I wanted to do. So I think any help, take it, because it's led to me, you know, doing what I want to do, I guess.
So Molly, did you talk, you mentioned confidence, then talk us around when you went on the event and you thought, I'm interested in this and I want some more help. So you took up that mentoring offer and you formed a relationship with Leon at HEE.
Yeah.
Did you have any nerves around it? Did you think, oh, I couldn't do that? Or did you just think, no, this is something I want to do?
Absolutely not. I was petrified. I'm not one to talk to people I don't know, because I feel like I can't sound professional or anything like that. But yeah, I was definitely nervous. I was umming and ahhing about joining the mentoring thing, but it was kind of like, you know, parents really, I guess, that pushed me, you know, to take the help. You know, why not? If you don't want to do it, it doesn't prove useful. Like, you've not really lost anything. I'm definitely glad that I hopped on that. I wasn't confident. I never expected to be, you know, someone talking on here, camera on, everyone listening to you speak. It's led to different opportunities like this to help with kind of communication skills and things that, you know, you wouldn't get anywhere else other than joining one of these kind of programs and just seeing where it leads you.
Yeah, definitely. So when you were thinking about taking up that mentoring offer and you're thinking, well, I'm maybe lacking a bit of confidence, I don't know what to talk about, I don't know what job area I want to go in, you can actually use all those reservations as a starting point to discuss with your mentor, can't you?
Yeah,
say,
definitely.
listen, I lack confidence, I need to work on it, I don't know what area to look in, help me. So definitely, thank you so much for that, it's really useful. So when we're I was talking earlier about all the different job roles tying in the NHS, so the different people a podiatrist was working with, or the different people an art therapist would work with. From your point of view, you're in first year nursing, how useful is it for you to learn about what other roles are in the NHS, what they do and how they link up?
very useful, especially when I'm on placement. Because in the nurse you go on placement for like half your course really, and out on placement I'm bumping into a lot of professionals and roles, things that I bumped into a physiotherapist the other week, and I was able to do a bit of a session with them. I went to radiology the other week and saw a bit of an MRI and just kind of being nosy. And I guess joining on these Zooms or whatever, everyone has their own terminology for like different things. You get a bit of an insight of their role and what they do. So when you bump into someone wherever you are, and if you eventually hop onto the NHS careers and somewhere within that, I think it's good to know the different people that you're potentially going to work with, know your colleagues, know who's around and why you're going to work with them really.
And do you feel the mentoring that you did with Leon, do you feel that helped gave you confidence to go on the course and actually meet other people and find out what other departments are doing?
Definitely. I was nervous about going to uni altogether, so I think kind of having someone to talk about it to, and just any questions really that you don't feel comfortable asking people at the university when you've only known them a few days or when you're just about to pick your course. You guys have met so many different professionals, so it's worth asking a question, and you could maybe signpost that to someone else to get the expert knowledge of it. So I think definitely.
Yeah. And did you feel, did it help your application, do you feel, to university, to say that you've had mentor and support?
Yeah, absolutely. I put it on my university application. Luckily I got into everywhere I applied, I managed to get in, so it definitely helped. I was applying during COVID, so I wasn't able to get any kind of work experience. I had nothing to show that I was truly interested in the course I was applying for, and I wasn't just kind of going out on a whim. So by doing this and showing, I put X amount of time joining sessions, trying to talk to the professionals and stuff like that, it shows that actually I know a bit about the course. I know that I truly want to do it. I spoke to people in that position and kind of hopping on that. So definitely say it was useful. I put it in on mine and it brought me luck, I think.
So you went on the Insight Day for nursing. You took up our mentoring offer. You decided to apply. You were really successful. You're in your first year of nursing, and you're still continuing to work with us, even though you've left obviously school and you're in your higher education, and you still continue to work with us. You filmed some promo videos with us to talk about, basically what we've spoken about then. You're coming on today as well to do this interview, and I have to say you've done a last minute interview yourself by talking about this, so you've shown how you can adapt very quickly. So I feel like it's really shown your commitment to being the best that you can possibly be in your career, not only just for your uni application, but you're continuing that. Now you're in uni, you're continuing that, and you can keep saying when you're applying for actual permanent nursing job, well, I've carried that on, I've been on Creating Careers, I've done these so it's absolutely brilliant, and we can't thank you enough for all the support you've given us and sharing that with students. Now, in a moment, we're going to get our podiatrist on, and Molly's going to introduce Usman and ask all about his role. Students, I can't emphasize enough, ask questions in the chat. Molly said earlier how important it is, even if you think, that's a daft question, there's no daft question, just ask it, okay? The more people ask, the more, we get involved, and it seems like a much more useful session. And I guarantee you ask a question and someone else will be thinking, I wanted to ask that. So you're helping not only yourself, but everyone else. So please ask away. So Molly, I'm going to hand over to you and introduce Usman, who's the podiatrist. If you could come on screen for me. Thank you, Usman. So if we could go from there. Molly, over to you.
So I guess it's my turn to now be the interviewer. So first question, can you tell us about your job title and what your job entails?
Okay, so my job title is a specialist podiatrist. A podiatrist is basically an expert of the feet and lower limbs. So we help anyone who's got all types of problems with their feet and legs. That could be anything from an ingrown toenail, sore heels, even knee, hip, lower back pain. Eventually they find their way to us.
Could you tell us like your pathway into this career? Like, is it something you always wanted to do? What kind of qualifications you got, like all that kind of stuff?
So my route to podiatry was not your normal conventional route. I already had a business degree and a master's in marketing, and I just felt like I wasn't satisfied with my job in marketing. I found it really boring because it became really complacent and it was all becoming digital, and I wanted something different. And I, excuse the pun, stumbled on podiatry. At the time, because I didn't have a biology A-level, I needed to do an access course, which was anatomy, pathologies, and physiology. Past that, you're in, which I did. And that was about 8 years ago. I never looked back.
That's amazing, to be honest, that you've kind of found your way into it after taking a different route.
I got lucky, but yeah, they launched. Basically, podiatry has been looking to recruit a lot more students over the years. We've got a very high-aged workforce that, unfortunately, in the next few years, with retirements, that we're going to have huge gaps in the system. So it's a big opportunity there now for youngsters to get in.
What does a typical day look like for you?
So because I work in the community, my job is both clinic-based and then what we call domiciliary-based. So I go to patients' houses. So usually I do clinics in the morning. That could either be high-risk work, musculoskeletal, and then in the afternoons I go off to patients' houses. Again, it's mainly high-risk work for when we go to patients' houses. They're bed-bound, they're housebound, they're unable to get into clinic.
Even though you go to houses, sometimes when you're in the clinic, can you tell us if there's any kind of other NHS professionals that you work with or kind of communicate with?
Yeah, so we do a lot of shared care with district nurses. So, for example, patients might have a heel ulcer, and district nurses will assist us with doing dressing changes. Again, tissue viability nurses, we refer a lot to them. Patients who have what we call edema, a lot of swelling in the legs, which can basically destroy the legs from within. We refer to them quite often. Physios, so when patients have knee pain, hip pain, leg pain, we can provide orthotics to help correct their gait, but they need physios for stretching and strengthening exercises. Orthotists, if patients have a very, how can I say, a very altered foot architecture that can't go into a normal shoe, they would have to go to an orthotist. So and then we're always in constant contact with GPs requesting medicine, antibiotics mainly, asking for referrals to dietitians for diabetics, asking for referrals to even occupational therapists. I ask quite frequently patients, have they fallen in the last 12 months? If they have you told your GP? Majority of the time they haven't, and they need support, because if they fall and it's a bad fall, they break their arm, they break their shoulder, then they end up going into respite, and then they might be in care for a long period of time. They're away from their families, away from their homes. It can have a big impact on an elderly person. So these are the other departments that we definitely link in with.
Even though your route into podiatry wasn't the most typical route for a student, do you have any advice for students that might be interested in this line of work, and what would that be if you had?
If you've got A levels, then biology A level obviously preferable, but don't be disheartened if you are doing 3 other different A levels. Just get on the phone. There's about 12 podiatry schools up and down the country. Just ask them what their criteria is. They might ask you to do an anatomy course. The reason they ask you to do that is because the first year you're looking at not just the skeleton of, let's say, and the muscles that go into the lower limbs and the feet. They'll start going very intricately into, let's say, the landmark. So you're looking at the heel bone, and there'll be like 5 distinct areas on just the heel bone. So not to throw you in at the deep end when you start, they want you to have a bit of background knowledge before you come in.
Yeah. Could you tell us maybe like your favourite parts of the role or least favourite parts?
My favourite part is when you can help someone. So you take away their pain, you solve their problem for them. I can't explain how much it means when they thank you. You can see the relief in them, because I'm sure for all your students out there, when you've had a problem and you have to go to your doctor or go to the hospital, you've gone to someone where you're hoping will solve your problem. And it's the same for us. The patients come in, they want us to solve their problem for them, and they can get back to leading their life. So helping someone, that's definitely the best part of the job. Worst part for me is when I go to someone's house and they have a little dog that literally barks and snarls at me throughout the whole session. The big dogs, they leave me alone. They're happy, they're relaxed, but it's the little ones, they don't leave you alone.
And lastly, the last question, is there any skills or knowledge that you got from school or kind of maybe even your other degrees that you've been able to take through in this career with you and like helped really?
I do a bit of private practice on the side, so having my marketing degree helped me to get a presence online. But in terms of from school, my maths skills are probably what suited me the most going throughout life. Having good arithmetic, understanding, just making, mental arithmetic is really important, but just understanding numbers is hugely important as you get older as well. And for those who, out there, maths is, to me, is probably the most important subject you're ever going to take. Yeah.
Well, thank you for that interview. I've definitely learned a lot. I think people are going to chuck questions in down below, and I don't know if there's a question and answer time later on. I think there is.
So there's one question there. You have to ask your local trust. So because of COVID, everything got changed. But if you ask where you live, your local trust, they might say yes. If not, definitely get in contact with, let's say, where you can study podiatry. So I'm in Manchester. The nearest one to me is Salford, and they would be happily let you come in for the day and check everything out. There's no actual difference between podiatry and chiropody. So traditionally, we're called chiropodists. But in around year 2000, to be in line with America, we called ourselves podiatrists because that's their terminology for the job role. So a lot of elderly people, they'll know us as chiropodists, but everyone really from like the age of 40 below will know us as podiatrists. What advice would you give your younger self if you could? For me, it would probably don't waste time. I think I wasted a lot of time between the age of 17 to 20, 24, 25. I really wasted a lot of time. I was one of the lads. I used to hang out with them a lot, and we just wasted days and evenings and holidays. And there was so much I could have done, so much, not in terms of studying, I could have done so much more. I could have done a mechanics course, like an evening course. I could have learned so many different things, and instead of just hanging out with the lads playing video games, and that wasted a lot of my time.
Usman, I've got a question for you, if you don't mind. When I was when we were looking at the pre-work for this session, I was looking on the NHS. Oh, your lights have gone. Is that because you haven't moved for a certain time? When I was looking at the pre-work for the NHS session, their careers website for podiatry, they had a video of a volunteer talking about podiatry, and I think she specialised in diabetes. And she gave all these brilliant examples of why you would want to be a podiatrist. And then she said at the end, but it's quite important that you enjoy to some degree working with feet, that you're happy to work with feet. So that had me thinking, are there elements where it can be quite squeamish, or do you just get over that quite quickly?
So when I first started, I did not want to see an ulcer. I thought I'm going to be a private podiatrist. I'm just going to do, your usual kind of like verrucas and what have you. But funnily enough, you see one, you see two, after you've seen about 50, you're just used to it. You really do get used to it. And when you're used to it, you look at it differently. But you can understand more about why they're breaking down. So diabetes basically destroys your body from within. But there's certain elements of diabetes that destroys the feet. So it kills off the nerves, you can't feel anything. It switches off the sweat gland, so you get really dry skin, but then that cracks open, that breaks open and ulcerates. Over time, it changes the architecture of the foot, so you get higher pressure points, which means because those pressure points stay there longer, more likely to break down, and it hardens tendons. You lose flexibility.
Yeah.
So you're stuck in certain motion when weight bearing, which again breaks down certain areas. So you see these patients and you're trying to help them first to get to heal the ulcer, but second, never to break down again. And that's the hard part.
Yeah.
To not, because what we say is once we've healed you, you're in remission. Like cancer, you're in remission. You can easily break down again. And unfortunately, some of our patients don't, they take that with a pinch of salt. They don't listen. A year later, 2 years later, they're back again. So it's not just dealing with the ulcer at the time, it's that constant battle to try and educate the patient for a better lifestyle, controlling their sugars better, looking after their feet, checking their feet every day. So many patients don't check their feet every day. I've had patients come in and I'll literally take a drawing pin out their foot. You know that's there. They won't know. They're shocked.
Yeah. So do you have a lot of long-term relationships with patients then, rather than someone coming in and out? You're actually forming long-term relationships.
So it's different from dentistry. So with dentistry, you're in the chair, your mouth's open, you don't talk to the dentist. Literally you don't. Same with the doctor. When you go see a doctor, you don't really have a chat with them. You tell them your problems. They might prescribe you some medicine or make the referral, and that's it, you're gone. With us, we're dealing with your foot for 20, 30, 40 minutes. We end up talking to you. And then if you have an ulcer and I'm seeing you every week for like a month, 6 months, a year, I've got to know you pretty well and you've got to know me pretty well.
Yeah, and using those communication skills, I suppose, to make people feel comfortable. And
well, you get an insight on their life and how they got to this point and what's going on with them.
Yeah, get some interesting gossip from the local community. We've had a question here from Leon, so this isn't me asking this, by the way, that's the caveat. Leon said he's sorry to have to ask, but what is turf toe?
I think you mean a retracted toe.
Mm-hmm.
That's what I think what you're referring to. We don't actually use that terminology here, but if it's a retracted toe, it's to do with your tendons. So if you imagine that you've got 12 major muscles in your leg and they all come into your foot as tendons and sit into different areas, over time, they don't stay straight, they don't lie down anymore. And if they just start contracting, it moves your toe back. And you get hammer toes, retracted toes, claw toes, and then you can get other problems. So for example, the tip of your toe here is not weight bearing. So if that's sat onto the floor, you develop hard skin in that area. It could be quite painful. You can develop corns in that area because the bottom of the toe is developed for weight bearing. It's strange how it works, but that's just how it is.
Does that affect your balance if your toes become clawed like that?
Yes, because you don't go through the gait cycle properly. And then because you're clawing all the time, you're putting a lot of pressure on the joints and it just gets worse. Really, they need stretching exercises, but by the time we get them, it's not too late, but are they going to do it? We're talking months of work to get that flexibility back. And then once they've got it back, they have to keep doing it to keep it flexible.
Yeah. So let's talk very quickly, if you don't mind, because let's talk sports. So I've been in the research that we've been doing before this session, sport keeps tending to come up, of being quite linked to podiatry. I've seen some case studies with podiatrists working with marathon runners and all kinds of athletes. Have you yourself had experience of that, working with sport injuries?
Not sport injuries. I've treated a couple of footballers, no one special. But footballers, for example, they like to wear really tight football shoes so they can feel the ball. And because of that, they develop a lot of hard skin, but I'm getting them, they've got corns in between their toes, which are quite painful. And they end up coming in every few weeks for that to be taken out. But we see injuries all the time. So for example, a Manchester United footballer, Phil Jones, he's known to getting shin splints a lot. And that the reason is that if you look from what we call the frontal plane, his rear foot does not sit straight down, it's slightly raised. So when he loads his foot, he slaps that heel down and it tugs on what we call the posterior tibial tendon. And by tugging on that, where that tendon originates from, the muscle in between his tibia and fibula bone in his leg, you get tiny tears. That's what causes the shin splints.
That's amazing. Phil Jones was injured for a very long time, wasn't he? He's recently come back in. Is it all linked to that?
Well, his shin splints were linked to that, but all these players that we see that we get to learn about, most of it's coming from their feet.
Yeah.
They either got leg length discrepancies or what we call the pronating, the over pronating throughout the gait cycle, but they rarely want insoles in their shoes because the football shoe can't accommodate it.
Yeah.
But then you ask yourself, well, you're wealthy enough, why don't you get a shoe developed? But they don't do it.
Might be a business idea there.
Could be.
So just to finish off, we've had a question in the chat about what would you say are the top 3 qualities needed to be, a top podiatrist?
So when you're looking at being a podiatrist, and when I was getting taught, they said some podiatrists would be really good at the academic side, but not very good at the hands-on side, because you've got to obviously use tools, you've got to have manual dexterity. Some would be good at manual dexterity, but not good at the academic side. Some would be good at both. Some would be poor at both. What I would say, to be a podiatrist, first you need patience.
Yeah.
Then you need empathy. You need empathy with your patients, because you're going to get people who are suffering. It'll take a long time, for example, to get onto the chair. You've got to have that emotional side to you. You've got to make that bond, and you've got to understand that one day you might be in their shoes. You'll be old.
Yeah.
You might not be able to get to your feet, and you've got to understand that from the relationship with the patient. And then thirdly, really just enthusiasm, because you can learn everything at university, but you've learned maybe a drop in the ocean. So when you start, you'll continue to learn and continue to learn, even to your very last patient. After you've had like a 50-year career, you'll learn something all the time. Something new will always come, and just be open for it.
Yeah. And that links, I suppose, to the NHS values, doesn't it? That commitment to constantly quality of care and learning and improving yourself, which we're always telling our students to make sure that they know those NHS values really well.
Yeah, we don't know all the answers. So it's like they say, we practice podiatry, we practice medicine, we practice dentistry. We've got a certain amount of knowledge. We build on the knowledge of past generations, and we just keep trying to develop more and more, because we haven't got all the answers.
Yeah.
You will get situations where you'll be stumped and you don't know what you're looking at.
Yeah. It's always healthy to be out your comfort zone a little bit, isn't it? It's character building. So thank you so much for today. I really hugely appreciate. I found that really interesting, learning, about your role in answering all those questions. And a huge thank you to Molly as well, who's an absolute example to all students at home watching, about to embark on their career as well. So as we said, the huge apologies about the art therapists. That is the nature of the NHS. But hopefully you may learn sometime in the future. Things come up, but we will. Any follow-up questions, please get them to us, and we can do a follow-up session with the art therapist and get every question you want answered. So I am now going to hand over to Abby to wrap up today's session.
Thank you so much, Leslie, and thank you to our speakers, especially Molly, doing it so last minute. Hopefully you can see the slides again. So our next steps, this is going to be uploaded to the Liverpool City Region's Careers Hub YouTube channel, but we'll also post that in the Google Classroom. You can come back at any time and watch them. We also post all the other links to the other videos in the Google Classroom. So if you've missed part of the Creating Careers with Health Education England series so far, and we've had quite a few, you can pop over there and you'll be able to see the pre-work, the roadmap, everything. You're going to receive a follow-up email right after this from me. It's going to include an evaluation link. It'd be really appreciated if you fill that in. It lets us know what we can do better, what you enjoy from the session, what you'd like more of. On top of that, it will have the post-work roadmap in. So you had your pre-work, you had this session, and the roadmap is really there to help you fill in things, figure out what you actually really enjoy. A lot of these sessions are just great to explore, to understand whether, do you want to go in this area of the NHS? Do you want to go into this career? And the roadmap can help you with that. So that will be attached to the email, but it's also in the Google Classroom. And then you also have the option for that follow-up one-to-one or the mentoring. As Leslie Ann said, mentoring is offered. If you are interested, even if you're a little bit apprehensive, we can have those discussions with you over email, wherever you're most comfortable, a video call, and we can explain what it involves, what would be expected of you. The whole way you're going to be supported. But as Molly said, it's just a great way to learn things, ask questions, find out new things, and it's always going to strengthen just you as a person on top of your career progression. You also have the Uni Connects that I spoke about before. Wherever you are in the Northwest, there is a Uni Connect there. That's the version of me from Shaping Futures. And we're here to support you, and we give you that one-to-one guidance. Most of us, if not all of us, are trained careers advisors. So much like your advisors in school, we can give you that one-to-one support. And then, of course, back to the Google Classroom. You can find the links to sign up there, but you will have a link in the follow-up email, and you know the link because you signed up already, but go and see what else is on offer the rest of this academic year from Creating Careers Live with Health Education England. We also have a tab on the website that explains which webinar might be for you. If you've never heard of it, something before, click on that. It'll tell you if you're studying something related to it, what it would involve, what your interest might be that will align with it. This all allows you to make the most informed choice for you. We have tons and tons on offer, so do check that out. We'll stay on for a few minutes, but thank you all for coming today, and we hope you enjoyed the session.